We must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home. You may only leave home for limited reasons permitted in law, such as to shop for essentials, to work if you absolutely cannot work from home, to exercise, to seek medical assistance, such as getting a COVID test, or to escape domestic abuse.
Well, Michael Tildesley is an Associate Professor of Life Sciences at the University of Warwick, and he joins us live from Coventry in the UK. Thanks for being with us. So it's come to a second national lockdown for England and the UK. How have we got to this point?
Well, I think there's a multitude of factors. Unfortunately, we had our short-term kind of circuit breaker lockdown in November, which was in place for 4 weeks. And it was pretty clear as we were emerging from that it didn't have the effectiveness we might have expected. We then had the evidence that this new variant was starting to emerge in the southeast and in Greater London, which seemed to be much more transmissible than previous variants that were circulating. And so all of these factors put together, we were starting to see through December that cases were rising in a really concerning manner. And it became really clear that sadly more action was needed. So this is where we are now. My big hope in the weeks to come is that people really do kind of take on board this message, adhere to the rules as much as we did back in March and April, where adherence was really, really high. Hopefully we can get back to those levels so that we can start to turn this around and relieve the pressure on our health service, which at the moment is under severe pressure around the country.
And you say it became clear that more action was needed, but given that, why wasn't something like this, a lockdown, done much sooner?
Yeah, and I think we can always argue this. I think, unfortunately, we've been in this situation before. I mean, I was one of those scientists that back in early October was calling for a circuit breaker lockdown because it was really clear that one was needed. Unfortunately, action on that didn't come for several weeks later. Again, as we were moving into December, it was really clear that, unfortunately, we weren't getting the incidence down as much as we needed to, given the government had committed to this Christmas relaxation. We then saw a very last-minute change of the rules over Christmas, and it seemed to be because of the Christmas period getting in the way, it was left till January in order to make the really tough decisions. So you could argue that really we should have had more action, as some of the countries in Europe did actually before the Christmas break. So this is where we are, perhaps later than a lot of us might have wished for. But now, as I said, we really do need tough action and really, really close following of the rules from everybody around the country to make sure that we do protect our health service.
And the Prime Minister seems quite confident that we're at a turning point and is somewhat hopeful for the future. Do you think he's right to be confident or hopeful?
Well, I think we're not out of the woods yet. We've had some really promising news about the vaccines over the last few weeks. Really, the government do need to use the time now to get as many doses out to the population as possible. And he did say in his address he was hoping that by mid-February they could have vaccinated all the over 70s, a lot of our health key workers and people in the vulnerable categories. In order to achieve that, it does need a significant number of people being vaccinated per week. So this needs to be done as rapidly as possible. If they do live up to that promise and have all of those people vaccinated by mid-February, we may start to see the pressure on the health service come down, the number of deaths starting to fall, and we can cautiously start to ease out of some of these restrictions. But it's going to take a little bit of time yet before we get to that stage.
OK, Michael Tildesley from the University of Warwick, good to talk to you. Thank you.